First time since the coronavirus pandemic began, we're hearing directly from Chattanooga's three main hospitals. This morning, they announced plans to begin reopening as the current shelter-in-place order is allowed to expire. Channel 3's Joy Dukes joins us now live with more details. Joy?
Cindy, during a conference call this morning, we heard from representatives of all three hospitals, CHI Memorial, Erlanger, and Park Ridge, and they detailed their plans to reopen, which could happen as early as the end of this month. They also shared what it's been like for medical workers on the front lines, as Chattanooga's doctors and nurses answer the call to test and treat COVID-19 patients.
These heroes that every day wake up and take care of their neighbors and their loved ones in this community. And
hospital officials are preparing to begin the process of reopening, which could start as early as the end of the month.
We see this as a dial, not a switch on and off.
Starting with reintroducing elective surgeries, which have been put on pause since March 21st.
We feel that this is the appropriate time that we can safely and effectively provide these extended services to the community, as Memorial pointed out earlier, that have been absent for too long.
The number of surgeries they're able to conduct will depend on the supply of personal protective equipment, which was previously a concern due to the lack of fast and reliable coronavirus testing options, with national labs overwhelmed.
The wait time was anywhere from 7 to 10 days. And you can imagine the amount of personal protective equipment we might use on a single patient.
CHI Memorial's VP of Medical Affairs, Dr. Matthew Kotze, says Baylor School researchers stepping in was a huge turning point.
We send our tests to Baylor. We have shipments every day. A shipment that goes in the morning, we might have that result that evening.
A third phase of testing that's happening in-house now makes results available in an hour. Now, with plans to reopen, officials from all three hospitals say the changes they've made in response to COVID-19 will remain in place.
We created areas in our hospital that we isolate the COVID patients, the positive COVID patients, our COVID units, both in the ICU and on the med-surg floors.
Steps these physicians say ensure the safety of staff and patients. They hope those continued measures will encourage people to seek treatment when they need it and feel confident in doing so. And representatives from all three hospitals say they will continue to implement restrictions around visitation, practice social distancing, and encourage the use of masks and PPE while they reopen. Reporting live in Chattanooga, Joy Dukes, Channel 3 Eyewitness News.
Thank you, Joy. Today,